Well, my friends, this is a serious and critical case of aneurysm of the internal carotid artery, bilateral internal carotid artery, aneurysm of the right internal carotid artery, and ophthalmic branch of the left internal carotid artery. Aneurysm. What is aneurysm? Probably within any video I have demonstrated what is aneurysm. Aneurysm means a sac. When the artery runs, sometimes there may be formation of a sac. How this sac is formed? It is due to the dilatation of the arterial wall. So the space becomes dilated, so the walls of these sacs become thinner and thinnest, and there is chance of rupture. And if once it ruptures, there is escaping of the blood within the tissues, and the case becomes very serious. Aneurysm may occur at any places, but especially occurs at the arch of aorta or abdominal aorta and elsewhere. In this subject, our today's subject is a 40 years old gentle lady has come from the Bangladesh, Pabna district. She developed non-ruptured aneurysm of right internal carotid artery. She went at Christian Medical College, Vellore, and the diagnosis is confirmed non-ruptured, এখন rupture করেনি, yet it has not been ruptured, non-ruptured aneurysm of right internal carotid artery. So in the right internal carotid artery, there is an aneurysm for which this lady is a victim of headache for last 20 years, and for which she had treated by a large number of homeopaths and allopaths locally. And in the left, that is in the right internal carotid artery. So pain in the right sided frontal region. Pain is here in this side for last 25 years. Now there is another aneurysm at the ophthalmic segment, at the ophthalmic division of the left internal carotid artery. If you know the picture of the carotid artery is it comes from the arch of aorta. It directly comes from the arch of aorta in the left side, and right side is the branch of the brachiocephalic tract. However, this carotid artery from both sides goes upwards, and very soon it divides into two branches. One goes into the brain, known as internal carotid artery. Internal carotid artery goes into the brain and gives numerous branches. It goes into the brain and gives numerous branches. The branches are posterior communicating artery, anterior cerebral artery, middle cerebral artery, and also one of the branches comes into the eye. That is known as ophthalmic artery. So ophthalmic artery which supplies the eye is a branch of the internal carotid artery. It's a branch of the internal carotid artery. Here is a clear picture. This common carotid artery goes upwards and divides into two branches. One goes direct into the brain, known as internal carotid artery, and another goes to the outside. It supplies the face, different parts of the face. One branch goes to the thyroid gland, known as superior thyroid artery. One is the behind the ear, posterior auricular artery. One goes to supplies all muscles of the face, known as facial artery. One goes to the back side of the head, known as occipital artery, ascending pharyngeal artery, temporal artery, maxillary artery, etc. And which one goes to the brain, gives the anterior cerebral artery, posterior cerebral artery, middle cerebral artery, and into the eye, known as ophthalmic artery. Now what happens in this case? The ophthalmic artery, there is an aneurysm also formed in the ophthalmic division of the internal carotid artery. So the eyesight of the left eye is totally lost. বাঁদিকের চোখে মোটেই দেখতে পাচ্ছ না, বাঁদিকের চোখে মোটেই দেখতে পাচ্ছ না, ঝাপসা দেখছো, আর ডান দিকেরটা পুরো নষ্ট হয়ে গেছে। So ophthalmic artery aneurysm developing in the left eye and right eye totally lost because the big aneurysm in the right internal carotid artery. Non-ruptured big aneurysm in the right internal carotid artery, and also ophthalmic divisions of the left internal carotid artery. So the case is serious. And in allopathic, that means in the modern medical science, there is no medicinal treatment except operation. ওরা অপারেশন করার কথা বলেছে। They have advised to operate without any guarantee. তার কোনো গ্যারান্টি দেওয়া যাবে না, কারণ দুই দিকে অ্যানিউরিজম হয়ে যাচ্ছে, কি করা যাবে? আবার অপারেশন না করে, if the patient does not take any operative stage, the case may be serious. At any time, the aneurysm, the ballooning may be ruptured. Ballooning rupture, when the ballooning ruptured, the case was grave. There may be internal hemorrhage in the brain and eye, and the patient may die. So the case is serious. And they have come to me. Now what will be our treatment? What will be the approach of treatment? What will be the mode of treatment by us? So hearing the different clinical terms, the terms related to practice of medicine, surgery, etc., our homeopathic physicians, many of our homeopathic physicians becomes afraid. They become afraid. It is a serious case, a serious disease. But my friends, the treatment part is very easy to homeopaths. Because homeopaths, the real homeopaths, the true homeopaths, the classical homeopaths, the Hahnemann and homeopaths treat the patient, not the disease. What are the symptoms or symptom totality of the patient? I have found the symptom matters little about the disease diagnosis, matters little about the clinical aspect of the patient. The patient is given to me right-sided frontal headache due to this aneurysm. Pressure in the pulse, in the ballooning. So right-sided, the symptoms are right-sided frontal headache for last 20 years. Angiogram shows bilateral internal carotid artery aneurysm. And which cause the diminution of the vision in both the eyes, and right-sided eyesight is totally lost, and left-sided eyesight is gradually diminishing. Now what are the homeopathically symptoms I have found, I have collected? Pressure heart ameliorates. Pressure heart ameliorates. The patient has a tendency to obesity, irritable a little bit, but consolation, amelioration, obesity tendency, heart pressure amelioration, thick leucorrheal discharge, and changeability of the mind, selected me, and also there is in the past history styes sometimes appeared over the eyelids. The medicine is pulsatilla. The medicine is pulsatilla. So I do like to prescribe pulsatilla 1, 2, 3, 4, 5, 6, 7, 8 twice in a day, morning and evening. And let's see the result. I shall share you, my friend. There are contraindications. The patient is thirsty. Pulsatilla is thirstless. I have told you repeatedly, matters little. After one symptom is contraindicates, do not think. About hundreds of symptoms, 10 symptoms, 20 symptoms, 1 or 2 symptoms may be contraindicated. So, tendency to obesity, consolation, amylation, prefers open air, changeability of the mind, dry tongue, leucorial discharges are thick, consolation, amylation, all symptoms go in favor of pulsatilla. So I have prescribed pulsatilla. Though the patient is suffering from the aneurysm of the internal carotid artery, matters little to me. The thinking is less to me, because I do like to treat the patient and not the internal carotid artery aneurysm. My objective is same in all patients, in all cases, in all circumstances, in all places. Treat the patient, not the disease. My patient is pulsatilla. She required pulsatilla, so I have prescribed pulsatilla, and let's see the result. Please remember this case. I shall share you, my friends.